Thank you very much, Mr. Chairman, Ranking Member Murray, and members of the committee. Thank you for giving me the opportunity to discuss with you today the role of the National Institutes of Health in research addressing COVID-19. There are at least 8 candidate COVID-19 vaccines in clinical development. The NIH has been collaborating with a number of pharmaceutical companies at various stages of development. You might recall in this committee that in January of this year, I said that it would take about 1 year to 18 months if we were successful in developing a vaccine. The NIH trial moved very quickly. On January 10th, the sequence was known. On January the 11th, the Vaccine Research Center met to develop a plan. And on the 14th of January, we officially started the vaccine development. 62 days later, we are now in phase 1 clinical trial with the 2 doses already fully enrolled. If we are successful, we hope to know that in the late fall and early winter. There are some important issues, however, in COVID-19 vaccine development. We have many candidates and hope to have multiple winners. In other words, it's multiple shots on goal. We'll be producing vaccine at risk, which means we'll be investigating considerable resources in developing doses, even before we know any given candidate or candidates work. I must warn that there's also the possibility of negative consequences, where certain vaccines can actually enhance the negative effect of the infection. The big unknown is efficacy. Will it be present or absent, and how durable will it be?
Given our history with vaccine creation for other coronaviruses, how likely is it? I mean, is it extremely likely we're going to get a vaccine within a year or two? Is it just more likely than not, or is it kind of a long shot?
It's definitely not a long shot, Senator Romney. I would think that it is more likely than not that we will, because this is a virus that induces an immune response that people recover. The overwhelming majority of people recover from this virus. Although there is good morbidity and mortality at a level in certain populations, the very fact that the body is capable of spontaneously clearing the virus tells me that, at least from a conceptual standpoint, we can stimulate the body with a vaccine that would induce a similar response. So although there's no guarantee, I think it's clearly much more likely than not that somewhere within that time frame, we will get a vaccine for this virus.
I'd just like to hear your honest opinion. Do we have the coronavirus contained?
Senator, thank you for the question. Right now, it depends on what you mean by containment. If you think that we have it completely under control, we don't. I mean, if you look at the dynamics of the outbreak, we are seeing a diminution of hospitalizations and infections in some places, such as in New York City, which has plateaued and started to come down, New Orleans, but in other parts of the country, we are seeing spikes. So when you look at the dynamics of new cases, even though some are coming down, the curve looks flat with some slight coming down. So I think we're going in the right direction, but the right direction does not mean we have by any means total control of this outbreak.
Do we have enough robust countermeasures in place that we don't have to worry about a bad fall and winter?
Right now, the projection, as you've heard from Admiral Giroir, with regard to testing and other elements that would be needed to respond, the projection is that by the time we get to the end of the summer and early fall, that we will have that in place. Of course, if you do not do an adequate response, we will have the deleterious consequence of more infections and more deaths. If we do not respond in an adequate way when the fall comes, given that it is without a doubt that there will be infections that will be in the community, then we run the risk of having a resurgence. I would hope by that point in time, in the fall, that we have more than enough to respond adequately. But if we don't, there will be problems.
You've stated publicly that you'd bet it all that survivors of coronavirus have some form of immunity. Can you help set the record straight that the scientific record, as it is being accumulated, is supportive that infection with coronavirus likely leads to some form of immunity? Dr. Fauci.
Yep. Thank you for the question, Senator Paul. Yes, you're correct that I have said that given what we know about the recovery from viruses such as coronaviruses in general, or even any infectious disease, with very few exceptions, that when you have antibody present, it very likely indicates a degree of protection. I think it's in the semantics of how this is expressed when you say, has it been formally proven by long-term natural history studies, which is the only way that you can prove, one, is it protective, which I said and would repeat, is likely that it is, but also, what is the degree or titer of antibody that gives you that critical level of protection, and what is the durability? As I've often said, and again repeat, you can make a reasonable assumption that it would be protective, but natural history studies over a period of months to years will then tell you definitively if that's the case. We don't know everything about this virus, and we really better be very careful, particularly when it comes to children, because the more and more we learn, we're seeing things about what this virus can do that we didn't see from the studies in China or in Europe. For example, right now, children presenting with COVID-19, who actually have a very strange inflammatory syndrome, very similar to Kawasaki's syndrome. I think we better be careful if we are not cavalier in thinking that children are completely immune to the deleterious effects.
The official statistic, Dr. Fauci, is that 80,000 Americans have died from the pandemic. There are some epidemiologists who suggest the number may be 50% higher than that. What do you think?
I'm not sure, Senator Sanders, if it's going to be 50% higher, but most of us feel that the number of deaths are likely higher than that number because given the situation, particularly in New York City, when they were really strapped with a very serious challenge to their healthcare system, that there may have been people who died at home who did have COVID, who were not counted as COVID because they never really got to the hospital. So in direct answer to your question, I think you are correct that the number is likely higher. I don't know exactly what percent higher, but almost certainly it's higher.
The mainstream media, and indeed some of my colleagues in the Senate, seem to want to paint each of your relationships with our president during this wartime effort as confrontational and lacking consensus. Can you categorically say here to the American people today whether this is true or untrue?
Yes, no, there is certainly not a confrontational relationship between me and the president. As I've mentioned many times, I give advice, opinion based on evidence-based scientific information. He hears that, he respects it, he gets opinions from a variety of other people, but in no way, in my experience over the last several months, has there been any confrontational relationship between us.